Hello everyone, it's a new year. Happy New Year. I'm Dr. Kimball, and because it's the beginning of the year and we got a whole new horizon in front of us, I wanted to give you a couple of the greatest and best that's coming in spine surgery for 2020. Some of you out there may have been thinking, I'm just waiting for new therapies to come, new technologies, and what can they do for the spine or my back or my neck problem that they haven't been able to do before. And so here are my top three. So number one in the space of spine surgery would be, I would say, a topic called stem cell therapy or regenerative medicine. Now, this is a latest and greatest. It hasn't really hit mainstream because insurance companies aren't covering stem cell injections in the spine at this point. And so if you're looking for it, you're probably going to pay out of pocket and it can get kind of expensive. The other thing to know about stem cell therapy for the spine is although it does and can work in many situations, it's not all created equal. There's lots of different types of stem cells. There's, amniotic stem cells. There's harvesting your stem cells from your pelvis or your hip, or there's taking fat stem cells and then modifying them and then putting them back into your body. Lots of different ways. There's a lot of arguments, a lot of science that's occurring right now to decide what the best way to do it. And also, once you've decided what type of stem cell, there's also different places to put it. And just having an injection, they're not all created the same. Some injections go into the disc, some go onto the joints around the disc. And so that's kind of an important thing to understand. It's a new field, and the science is still evolving. Number two, in the space of spine surgery, disc replacement therapy is really starting to catch fire. It's been held back, not really just by technology available, but our FDA approval process in the United States has really slowed it down. Now we have an authorization from the FDA to do 2 consecutive levels in the neck, and we're hoping to get that approval in the lumbar spine early this year. So that's going to be really awesome. I will say that insurance companies, they're super slow to adopt these things because they don't want to pay for anything sometimes, and they just make it as difficult as possible. I spend a lot of my time fighting for my patients just to get the therapies that we're recommending. But disc replacement therapy is becoming more and more available because the insurance companies are opening up. Now you may say, well, what's new about that? Well, listen, if you can't afford it, you can't pay for it, and you're paying for health insurance, this may be a new possibility for you. Beyond and above that, I would say that as it's becoming more commonplace, the indications for disc replacement are growing. They certainly are in my practice, whereas maybe 5 years ago, offering a disc replacement would have been for a very, very small subsection of the population. And now what I find in my practice is that I'm doing more disc replacement than I am non-disc replacement or fusion surgery. So it has definitely become like the standard of care in my practice. And that, if you had predicted that 5 years ago, that would have literally not been possible. And so that's multifactorial. Part of it is, opening my mind, practicing and getting experiences in Germany and Australia and seeing how they do things outside of this country. Without those perspectives, I know that I wouldn't have, the insights and the understanding and really just the conversion to the success of disc replacement, how it can affect treating the spine. Number three, there are some really amazing technologies available in the spine that have not been available, and this is a whole new space in spine surgery. It's called robotic spine surgery. Now, fortunately, it doesn't eliminate me because then I wouldn't have a job, so it's okay. They're still required a neurosurgeon to operate and to approve and to utilize robots, but we're using robotic spine surgery in placement of implants and screws around important structures in the neck and in the low back, to make surgery safer for patients. Not that it hasn't been safe in the past, but if we can offer these new advances using proven mathematical models and things like that, it's amazing. We're utilizing all these advances here in our practice, and just want you to know that we're going to be offering you all of these options and techniques and technologies in this new year, 2020.